we've got a little bit of time left. I mean, I think if we haven't really covered the erectile dysfunction topic,
No,
but I thought
novel
maybe we
approaches
should,
to
just to
Shockwave.
give things a lift at the end of the program,
So to speak. Yeah.
Do you want to talk us through? You talked about blood flow. That's all important.
Yeah.
Do you want to talk us through prostatitis? You mentioned a little bit as well.
So in my clinic in Suffolk, because in the other one not so much, in my clinic in Suffolk, I've got a good physio that's qualified in all the men's health approaches. So that would be anything from post-prostatitis, pelvic floor rehab. So I'm repeating myself a lot, isn't it? So the Shockwave aspect to things like erectile dysfunction or chronic pelvic pain syndrome, which is the new term for non-infective or non-bacterial prostatitis, which is a really horrible, painful condition. Shockwave therapy on the pelvic floor as a muscle, and with hands-on work as well, and with stretching and rehab and so forth, as a modality in amongst that, has got some fair evidence for these desperate patients, because it's a really hard to treat condition, the CPPS. Erectile dysfunction, there is some reasonably good evidence that the angiogenesis factor comes in, and it has also an impact on the same mechanisms by which the PDI5s work, which are the Viagra and Cialis. So they basically keep an enzyme floating around in the system, nitric oxide as well, which basically keeps the vessels patent, which allows blood to keep flowing in. And it seems to optimize those things in the same way the drugs do, but it seems to have a much longer lasting effect. So if you take someone that started to lose the impact of those drugs after 5 years, which is not uncommon, 5 years is about when they start to tail off. And these patients are now seeking help from Shockwave to say, how can I boost the actual health of the tissues? But it would be us giving them advice on their diet, us giving them advice on exercise, losing weight, inflammatory.
Approach.
It's a hugely complex condition. So yes, but as soon as you mention shockwave, sound waves on the penis, it becomes this sort of half jokey thing, which is, oh, you just put it on the penis and charge them a lot of money. No, they're way more complex than that. My physio sees most of those.
Complex approach? I presume people who are drawn to what, I know you've got mentioned that on your website, I presume you get some interesting inquiries.
We do, and some people do like a quick fix, and we just we don't take them on, basically. Right. We filter out patients that understand what their condition is. We only take patients on that have seen their GP or urologist for a proper diagnosis with CPPS or for erectile dysfunction. They've been through the gamut. We've got a private GP that works in our clinic that also sees them for a screening of things like testosterone and cholesterol. It's if you're going to go down that route, which is, as I say, novel for a reason, because it's incredibly hard and complex, and these patients are fairly desperate. For obvious reasons. So the psychological aspect involved in that. We've also got 2 clinical psychologists that work in my clinic. So I surround myself with people that know a lot more than me. But I deal with some of those initial conversations, and they can be quite difficult and challenging. Yeah.